Welcome to The Last Track, where we help people showcase the last track of their life story in their final wishes. I am your host, Brian Norris, the co-owner of Bateman Funeral Home in Newport, Oregon. Just like a song can bring you back to a day, a time, and a memory, so too can a well-planned service. Hi, my name is Brian Norris, and I am the managing partner of Bateman Funeral Home. And I have a wonderful guest with me today that I would love to introduce to you. Her name is Theresa Karlik, and she is an RN and a manager at Samaritan Coastal Hospice, based here in Newport, Oregon. It's the beautiful part of the Oregon coast. We really work closely with hospice, and they are the experts. And I would like to give you all a chance to meet her, and I'm going to ask her to introduce herself in just a moment. Tell us a little bit about herself. And so, Theresa, why don't you tell us a little bit about yourself?
Thanks, Brian. I'm so happy to be here. So my name is Theresa Karlik. I am the manager here at Samaritan Evergreen Hospice, and we cover all of Lincoln County as our service area. I have been a nurse for 24 years now, and the majority of that time, my passion and love has been hospice. So I truly enjoy teaching about hospice. So that's why I'm happy to be here today, so I can educate people about end-of-life care and their options that they have. And I have an amazing team that I work with: nurses, social workers, chaplains, physicians, bath aides that love to serve our community.
Well, thank you. And before we get started, I actually have a piece of paper here, and my manager up in Lincoln City said, "Can you please make sure you pass this on to Theresa?" Okay. And she said, "My families that are entering hospice are so appreciative. I always hear the staff is so nice and helpful. And when the families are meeting with me, they can't stop talking about how great your hospice person was." And so she said, "Please pass on thank you from our team up north as well," knowing that we were going to be doing this recording today. And you said it right. I mean, you work with a wonderful team, and it takes the whole team to do all of this, doesn't it?
It does. And that's part of what I love about hospice is we are a team. It's not just one person who has to do it. We all can work together. We lean on each other. There are days that this job is completely hard for our staff as well as patients. And yes. So when the staff can come back and lean on each other, it is absolutely amazing.
Yeah. I've even seen some of your people when we have a service for somebody, when they actually have a memorial service or something, they'll come to that because they've established such a close working relationship with their families.
It is. And I think it's important for us to be able to have that closure with our families too, when we can get back to having real in-person services.
We're so close. We're so close.
We're getting there. It will be good.
Yeah, this pandemic has definitely been interesting and challenging for my industry as well as your industry. And I know working with you guys, boy, it can sure be tough.
Oh, you never expected this. And these last 2 years have been such a challenge for everybody. And I'm hoping we're getting to that light at the end of the tunnel.
Well, let's get to what we were here to talk about. We're talking about hospice, and let's maybe talk, what is hospice? Let's just start with what is hospice, and then we'll start talking about some differences, but what does that mean?
So hospice is a philosophy of care. So it's comfort care at the end of life. So from a technical Medicare standpoint, we have to believe that we are in the last 6 months of life, or a doctor feels that somebody's at that last 6 months. We come from that multidisciplinary group that I kind of talked about: physicians, the nurses, the social workers, the chaplains, and bath aides, to all come and offer comfort care at the end of life. It's not about somebody to watch and hurry up and die. It is, let's give you the best quality of life in the time that you have left. So it's for people who have that life-limiting diagnosis. That can be cancer, that can be a cardiac disease, that can be a breathing COPD, and it can be just general debility, old age. And
Right.
that with that guidance of that, I think we're in the last 6 months, and hospice comes in to make sure that people are comfortable, that the families know what to expect. So we do that by education. The nurses come and visit. They can visit 2 to 3 times a week. They can visit more if needed, less if everybody's having a good day. But that nurse is available to the families and the patients 24 hours a day, 7 days a week. And when I say patients and families, I truly mean that as one unit. It's not just the patient we're taking care of, it's the family. We firmly believe that the family needs our support just as much as this patient who's dying, and sometimes even more, to help them walk through that. So I said Medicare, we are a Medicare certified, so we have to follow certain rules, but that's who pays us. But we also take private insurance. We take no insurance. It all depends on where the patient is
Right.
at that point. And with our goal of comfort care and the best quality of life. So we become experts in pain management, symptom management, breathing, nausea, agitation. All of that are things that my nurses and my team look at every time they go in and make a visit.
Right. So you mentioned a couple of the key takeaways on that is it's just generally the person's not expected to live longer than 6 months.
Right.
You guys do use Medicare. You also use private pay. You probably use a combination of both, possibly. If Medicare only picks up to so far and they want a little more, then they can private pay that difference, correct?
So Medicare pays us for everything that we do. We get about $200 a day. That's on a per
Right.
diem. And with that, we are expected to provide all the visits from all the disciplines. We provide the equipment that somebody needs, so a hospital bed, oxygen,
Right.
any of that. And we also provide all the medications. The one thing hospice
Right.
doesn't provide is the custodial care. So if you need caregivers, that's not paid for by Medicare. That's not paid for by hospice. Medicaid will pay for that, or private pay can pay for caregivers to come in. And hospice, what I love about it is we'll see patients wherever they call home. So that's private home, nursing homes, assisted living, foster homes, wherever the patient is, we'll see them. But we don't pay for any of that. Kind of, if they need nursing home care, that's not covered by hospice.
Right. Okay. That's good to know. And I love the fact that you say that it's wherever they call home, because, I think traditionally people think, well, at their home, but they may be like at a rehabilitation center, or they may be somewhere else. And so you would actually go there as well.
Right.
So they don't actually have to go to their home, because we get families in here sometimes that are saying, well, mom is here and we really don't know if you can go back with dad. And again, I'm like, well, we're not the hospice people, but that's good to know that they could actually leave mom where she's currently at, possibly, and then the hospice team will come in there.
Right. And where I feel like we're really experts at is those patients who are in maybe not the best home environment, but this is what they know. Well, let us come in, let us help out. And that's where my social work team can come in. And you don't have to be placed today, but let's work on a plan. If somebody who lives alone, it used to be, we'd say, oh, you can't come on hospice if you don't have a caregiver. Well, you do need a caregiver, but let us work with you to find that right place.
And you do all of that too.
We do. It's been a much more of a challenge these last few years finding placement, but those social workers are amazing, can get out there and work their magic.
So you just never go home then, right?
I don't. I'm available on this phone 24/7. No, I have to say that working under Evergreen Hospice, I have a fabulous team who supports me as well. So there's always somebody to help our team out.
Yeah. So I guess maybe we've talked a little bit about what hospice is. One of the other questions that we get, or I'm sure you get as well, is when is the right time? When do you know if it's the right time to do hospice?
That is always a tough question. And that comes up to an individual families and beliefs of when it is. When you're at a point, let's say you have a cancer diagnosis and the treatments are making you sicker than they are helping, or the doctor's saying, I can't offer you anymore at this point, or you just don't want to do it. You don't want to be poked and prodded and spending your time going back and forth to the hospital. That's the right time for hospice. Or, you're just declining. If we look for weight loss, if you can't eat
Right.
very much anymore, you're sleeping most of the time, and the doctors are now saying we can't offer you a curative treatment anymore. Maybe you should think about comfort care. That's
Right.
going to come. What I say to everybody when I do these kind of talks is, if you have questions, call me, call and talk to us. We are happy to go out and do what we call an informational hospice present anytime. And that just means going out and talking about what it is that we do, how we do it. You get to interview us. We kind of look at your loved one or at the patient and say, okay, now is the time. We run our patients by our medical director and our team, so they kind of look at it with that eye and say, yep, we believe they're ready for hospice, or no, maybe not yet, and maybe they should continue on. The one thing I can say, and this happened to us just a few weeks ago, is have these conversations early with your families about, maybe it's not time for end of life care right now, but have the conversations about what you want the end of your life to look like, which is always so taboo. People don't want to talk about end of life.
No,
But
they don't.
have that conversation that says, this is what I want, because there's nothing more heartbreaking for us than to have a family divided and they're fighting amongst each other at this point. And we can see that hospice is the right way to go. But hospice is neutral. You as a patient and the family make that decision of when it's right for you, and we're going to support you in that. But it's so sad to see that fighting of somebody wants full care and somebody doesn't want full care, and the patient can't make the decision for themselves, and having that fight over them is terrible.
Yeah. No, that's some really good points. I'm going to mention a hospice doctor that you had a number of years ago. His name was Dr. Sparks.
Oh, yeah.
Amazing guy.
He's amazing.
And when my mom was deciding whether she should go on hospice or not, she was at a rehab facility here in Newport. And he had come in, was making his rounds, and was actually laying on her bed, talking to her. And as they were carrying on this conversation, mom was having that, do I go on hospice or not at that point? And during the conversation, my mom had said a couple of words, and Dr. Sparks sat up and he goes, wait a minute, that was like a 5-syllable word. He said, your brain's still working. Do you really want to do hospice at this point? And so they had that more conversation, and she opted not to at that point. And we had another 2 years with her. And part of it's that balance between quality of life and quantity of life and care and all that. But you're right. I mean, those are definitely those conversations that need to be made with family, and talk about what somebody would like to have. Should you or should you not, do those things? As far as, you hate to use the term pull the plug and all that, because that's what everybody talks about. But yeah, great points.
And I truly think that people have this misconception of hospice that means that you're dying today. If the doctor says, oh, you should be on hospice and you're dying today, that's not true. Well, it's not what we want. I mean, there are those patients who come on and we have them for less than 24 hours. Our goal is always to have them for as much time as possible, to build that trust, to build that rapport, to help them along. But it doesn't mean you're dying today. And also we have a group of patients who come on, we start helping them, we manage their pain, or we de-prescribe medications. We take some of those medications that they've been on for years and change them, and they start feeling better. And patients sometimes do better. And we have hospice graduates all the time. So they come off.
I love that you call them graduates.
They come off a hospice and then they can come back on when they need us. And so just because you sign up for hospice doesn't mean you have to stay with us forever. I mean, if you don't want us, one signature, go back to doing whatever.
Yeah. I had a lady up in Portland when I was working up in the Portland area about 10 years ago, and she had actually been on and off of hospice twice. And as she graduated, like you say, she came off of they actually went to Hawaii, had a wonderful family vacation. She was doing great. And they literally had almost 2 more years. And then she went back onto hospice, and then she was ready.
Right.
So it is, we get the phone calls. Grandma mom was just put on hospice yesterday, and so we need to do something. Well, true, we need to start working that way, but doesn't mean that they're coming into my care tonight.
Right.
So,
and we have, just because we have that 6-month guideline Doesn't mean once somebody hits 6 months, we say, okay, you don't need hospice anymore. We have had a couple patients who've been on for a couple of years. As long as I can document that they continue to need us and that there's a decline, we can keep people on. And
That's good. That's good to know.
Yeah.
So now you used a term in there that was comfort care and hospice. And I know people have that, you know, they can get on palliative care. And can you tell us some of those differences? And are they all related? Are the same thing, or what are they?
So so palliative care is like an umbrella that hospice falls under. So palliative care is comfort care, symptom management with a life-limiting illness. Under palliative care, you don't have to agree to stopping your other treatment. So with hospice, you have to say, I'm ready to be done having my curative care. I'm ready to be done going back and forth to the hospital. I want to be home and be comfortable. Palliative care is getting those symptoms managed under that same kind of hopefully interdisciplinary plan and keeping you comfortable, setting goals of what the end of life will look like, but not doing it under the hospice strict guidelines we have. It's a little bit more open. You don't have to be in that last 6 months. You can be in the last few years or whatever that looks like. We don't have a home palliative care program here in Lincoln County, but Theresa Karlik from Lincoln City is starting to do palliative care consults within Samaritan. So she is going, so if somebody doesn't quite meet hospice criteria or is not quite ready for hospice, then we kind of point them in that direction where she can still look at pain and symptoms. And I think, like I said earlier, that goal setting conversation is, what is it that you want as you're getting sicker, as your disease progresses? This is what you could see. This is how you want to treat it, or just what is it that you want? Once again, starting those conversations that sometimes are really hard for people who aren't at end of life care yet, or who aren't in end of life care, hospice, palliative care workers. So starting that conversation and giving patients the power to make those decisions. I think there's a lot of patients out there who say, well, the doctor says I have to do this. And you don't always have to.
Yeah. So we talked a little bit about people having that conversation with family members and having a little bit of that conversation with you. Do you recommend that they bring certain items with them or have certain items available to them when you have that conversation of end of life and what it looks like and moving to the hospice care?
Sure. So I firmly believe that all of us, regardless of our age or diagnosis, should have what's called an advance directive. So that is where you write down what it is you want if you can't speak for yourself. So if you were to have a car accident tomorrow and you can't talk, what is it that you want to direct the doctors to do? I mean, do you want tube feedings? Do you want to be on a ventilator? All of those questions are answered in advance directives, as also is who speaks for you if you can't speak for yourself. And
that is so important.
It is. And it's important to pick somebody who is going to honor your wishes. So if your wishes are for to have 100% full treatment no matter what, making sure that you have somebody to advocate for you for that. If you're like me and there's certain things I absolutely do not want, I want to make sure that I'm picking that person who's strong enough to say to the doctors, enough is enough. So having an advance directive filled out, if you don't have one, we're always happy to give you one and talk about it. What is it that you want? Your end of life wishes, a pulse form, which means physician's order for life-sustaining treatment. That is where we ask you, if your heart and breathing were to stop at a natural end of life process, do you want to have CPR? Having that question answered is really important for us. What is it that you want? What are your wishes and dreams? Those are all things to bring. For us, from a standpoint of medical records, I have to be able to have access to your medical records to see if you are appropriate for hospice, if you're coming to talk to me or answering these questions. But other things, I can't imagine what else I would need. We like to just talk and see what's going on with patients.
Okay. You know, you mentioned, and we have this challenge every now and then here where somebody comes in and says, well, I have a power of attorney, and power of attorney passes on death and so it makes it kind of difficult sometimes. We have people sometimes that pop in and say, I'm the oldest son, or I am the oldest daughter, and therefore I'm in charge. You'd mentioned making sure you have somebody there that can advocate for you and who's going to speak for you medically. If somebody doesn't have that written down, what kind of guidelines do you have, or should I say not guidelines, but rules and laws that you have to follow?
So the rules are, well, we have to follow HIPAA that I think everybody knows. So we can't talk to just anybody about you. So if you can't speak for yourself, it does go to what in our terminology would be next of kin, a little bit different for you, but
Sure.
the spouse is a primary decision maker. If there isn't a spouse, then usually it is the children, oldest child kind of down, which is why I say it is so important. We do pay attention to power of attorney. Power of attorney is important for us. So if there is a power of attorney, that's who we have to talk to. When we do admit patients to hospice, we have them fill out a friends and family form so that they say to us who we can and can't talk to. And some days it's really hard. You'll get somebody calling you up and saying, I need you to tell me what's going on with so-and-so. And we have to say, sorry, you need to talk to, well, I can't talk to them. They don't want to talk to me. And that feels really awful, but we have to support the patient's wishes and the HIPAA rules.
Right.
So.
Yeah, because we have some of the similar situations where, well, I'm not talking to that person. Well, I can't help you there.
Right.
Maybe. So one of the last questions that we get, because when somebody passes away, then we start coming into the picture. What happens when somebody has been on hospice care and they pass away? What should the family members do? And then kind of maybe step us through what you guys do before you make the phone call to us.
Sure. So one of the things when I am talking to people about coming on to hospice, that's really nice is hospice is considered an attended death in the home. And when you have an attended death, it's one phone number to call hospice. So our goals are to be walking through this process all the way. So seeing what we're seeing, okay, the patient's getting closer to death. We think we have the next hours to days and what you're going to start seeing and having that conversation. So it shouldn't be a surprise when somebody dies. But as with all of hospice, when you need anything, you have one number and you call hospice and there's a nurse 24/7 who can come out and visit. So when the patient dies, sometimes we've been out there and we've been preparing them. And that at that actual time of death, they call us and they said, okay, my loved one has died now. And we come out and we can confirm that. Some patients don't want us right at that time of death, and the families, they say, we've got it under control. Please just have the funeral home come out as soon as possible. We make all of those phone calls then for that family. With hospice, because it's an attended death, you don't have to call 911. You don't have to have the police to come out, who then turn it into a police matter versus a medical, comfortable thing. So a lot of families appreciate that. Now, we'll give a caveat to that if we feel that there's something has happened in the home, of course, then we have to call the police if we feel like there's something strange going on. But we then just call the funeral home of choice and let them know what's happened. And then we give them all the information that they need. We give the funeral home all the information that they need. Who's the doctor signing the death certificates? All of that gets turned over to the funeral home, and then you guys take care of it from there. We always tell our patients there's absolutely no hurry. In the state of Oregon, you have 24 hours before the body has to be picked up. So we're giving people that time that they need. There's those patients that say, I want every minute with my family. I want that 24 hours. And there's others who say, pick me up as soon as possible. So we're working with families for what that need is. And then something a lot of people don't know about hospice is after the loved one has died, after they've gone to the funeral home, we cover bereavement for 13 months, as much or as little as that family needs. So they don't feel like they're just dropped and off on their own. So our social workers will make bereavement phone calls. We have right now, it's online grief support groups virtually. We're hoping that we can get back to in-person here pretty soon. And then we also send out literature every few months about what you need. And then one thing that all hospices across the United States do is have our Light of a Life ceremony, which we remember all of the patients that we've taken care of in the last year. And one of the things that the pandemic did do for us is that we did make that virtual. So families can view that slideshow anytime, 24 hours a day, 7 days a week, all year long. That slideshow for Light of a Life is available. And so people who don't live here in town, who can't come to our ceremonies, can see that online.
Yeah, that's a beautiful ceremony. And when we were able to do it in person, it was beautiful to be able to have people go there and have flowers and be able to talk to each other. It's a wonderful service that you provide for the families.
And like I said, I think it's just as important for us as the staff who've taken care of these patients to remember them for this last year, to read those names of however many people we've taken care of and see those loved ones. And we have that being able to say goodbye and letting go so we can take care of the next group.
Well, we've been talking with Theresa Karlik, and she's an RN, and she's the manager for Samaritan Coastal Hospice here in Central Oregon Coast in Lincoln County. Thank you so much for being able to talk with us. I am going to ask you, if the audience wants to find out more information about you, about what the services you provide, what's the best way for them to find that information from you?
Oh, so the best way is they can call me anytime. They can call any hospice if they're not here in Central Lincoln County, that they can call any hospice around. But my phone number to get a hold of me is 541-574-1811. Any of our nurses are happy to talk. If you just have questions about maybe it is time for hospice, we're happy to answer those questions and see. We're happy to help communicate with your doctor if that's hard to do. We'll call your doctor and say, hey, this patient's interested in hospice. What do you think? And they'll either say yes or no. And if they say yes, then we can start that going and come and visit at the home.
Well, thank you so much. Love all of the information that you provided. Again, the families that come in here, they're so grateful for having made the choice of going on to hospice. They always make comments about all the people that have served them and have taken care of their loved one, as well as they say it's probably one of the smartest things they ever did. And they couldn't imagine how anybody could go through that process without having the support team that you guys provide. So thank you so much.
I appreciate you having me. So thank you so much.
Every podcast we take a moment and we take a moment to remember all the families that are experiencing a loss and to light a virtual candle in their memory. So let's take a moment and remember them. This has been The Last Track. I'm Brian Norris, and you can find out more information about Bateman Funeral Home at our website at batemanpacificview.com, or you can visit us on Facebook. If you have any feedback or any questions about today's episode, you can leave us some feedback on our Facebook page, or you can give us a call, 541-265-2751, or you can email us at info@batemanpacificview.com. We'd love to hear from you.